At a monitoring station in New Delhi, government scientists measure air pollution. Machines work around the clock, sizing up dust particles and calculating levels of toxic gases, like nitrogen dioxide and sulfur dioxide. Tests here show pollution levels are rising, fueled by India's rapid growth.
Population are increasing, day by day number of vehicles are increasing. So that is why pollution level for some parameter like nitrogen dioxide is slightly increased. But particulate matter is also increased. That is a natural problem.
A new study by Yale and Columbia University says India has the unhealthiest air in the world, even worse than heavily polluted China, because it contains the highest number of the type of microscopic particles that can be easily trapped in people's lungs. That filthy air is down to these. Nearly 1,300 new vehicles are registered daily in the capital alone, clogging up roads across the city. But coal fires, industry and natural dust from India's dry climate are also culprits. All this means cases of respiratory illnesses are swelling. At Delhi's top chest hospital, there were 80,000 patients last year, double the number 15 years ago.
So if air quality is bad, then symptoms tend to be more. So there is greater need for medicines, greater need for health care. People may have acute attacks, may end up in emergency rooms, hospitals.
A decade ago, the government tried to tackle pollution. Factories were pushed out of the city, rickshaws and buses forced to use compressed natural gas instead of diesel. Pollution dipped, but it's crept back up. Authorities have since opened a metro system. Environmentalists say that's a start, as better public transport is essential for the fast-growing city of nearly 17 million people.
How can we reduce the air pollution levels with the help of, by taking off the vehicles and the vehicle numbers from the city and improve the overall mobility of the city? That will be the most important strategy for us.
Whatever the strategy, campaigners say unless urgent action is taken now, a breath of fresh air in India is a long way off.
Air pollution in India is the leading cause of poor health as well as the reduction in the quality and quantity of life. From 1997 to 2006, the number of registered vehicles in New Delhi rose from 1.5 million to 4.5 million, and it continues to increase by an average of 963 private vehicles every single day. And almost 18 million additional cars will be sold this year alone. Also, emission standards in India are legally nearly 10 years behind European standards. 10,000 people die from air pollutants in Delhi every year alone. And in 2010, 3.5 million people died from air pollution-related illnesses in India. No one can escape the toxic air, a quote from Ms. Roy Chaudhary. There are three main contributing factors: vehicle emissions, industrial emissions, and lastly, biomass burnings. High is that 75% of Indian households still use solid fuels, and 90% of households in rural areas. An estimated 400,000 deaths from acute lower respiratory infection in children occur annually, and 34,000 deaths from chronic obstructive pulmonary diseases in women are attributed annually to indoor air pollution.
Problems such as air pollution are hard to solve, but there are always solutions. By enforcing frequent compulsory inspections, we can ensure that vehicles and factories are not emitting too much. What the inspections could do is they can monitor pollution emissions every 6 months and make sure everything is functioning properly and nothing is causing excess emissions. If certain vehicles are simply extremely inefficient, they should pay special taxes, which could help the government deal with other challenges. This would convince people to buy more efficient vehicles as well.
Another solution is for us to adopt Euro standard roads, and this will reduce traffic, therefore fewer toxins will be emitted.
According to 2012 Environmental Performance Index, India is ranked as a nation which breathes the highest level of polluted air. The country has been ranked at 125th spot in terms of tackling pollution and natural resource management challenges, which is harming environment the most.
Since the issue is so immense, there is no one solution. So to fight this problem, we can use a combination of all of the ideas we presented. However, we will need the combined effort and contribution from the government, non-government organizations, as well as international non-government organizations. But most importantly, we need your effort to spread the word and help us tackle this gigantic, ever-growing issue. Thank you.
Most of the cities, like wherever the pollution monitoring has begun, are largely showing that PM10, particulate matter of 10 micron size, is becoming a major problem in most of the cities, and they exceed the standards by more than 1.5 times.
The survey, which was conducted by the Yale and Columbia universities, addresses pollution control and natural resource management challenges. The study ranked 132 countries on the basis of 22 performance indicators in the following 10 policy categories.
The studies done by Central Pollution Control Board and CNCI, that is the Chittaranjan National Cancer Research Institute, they have said that around 40% of the Delhi's children have lower lung function. That is, like their lung capacity to exhale and inhale air has reduced. And there are also several asthma cases as well, prevalent in Bangalore and in Delhi.
Ranking Switzerland on the top slot in the index, the study reveals that India faces a challenge of significant air pollution.
Over the last few years, India's performance in terms of controlling air and water pollution has been reported very poor. And this study certainly confirms the other studies conducted by several environmental bodies earlier.
Another recent study conducted by the Center for Science and Environment said that 80% waste in India ends up in the country's rivers, as the urban growth across the country remains unchecked. Environmental experts call it a result of rapid economic growth and its toll on the environment.
Definitely pollution is causing havoc in our cities, and while our air quality monitoring has been strengthened, our health monitoring is primarily weak.
They further warn of devastating consequences if the government doesn't come up with immediate measures for reducing pollution and environmental degradation in future. Munawar Zaman, Press TV, New Delhi.